Keeping people at home may not have been the only strategy to deal with the COVID-19 pandemic. A hard lockdown with many people homebound had a negative effect on the economy in general and also on general practitioners. GPs have come up with a plan to help keep them in business. One medical professional says that a smarter lockdown would perhaps have been a better strategy. Joining us for more on this is Wits School of Governance Professor Alex van der Heever. Good evening, Prof, and thank you so much for your time today. Firstly, let's just look at why GPs have come under such incredible strain and there's been such a significant drop in their numbers. Does it mean people are less sick than they were before?
No, and it's not only affected general practitioners, it's, dental practitioners, ophthalmologists and specialists as well. And a lot of it has been because of the fear of coming into practices and medical establishments on the one hand, because people fear that those particular environments are at a higher risk of infection than others. The other issue is, and this is going to become more prevalent going forward, there's a risk going forward that a lot of the health practices may in fact be infected themselves. They close down and the practices can't receive patients and certain hospitals can't. So those basically are the main reasons.
I'm wondering, are you finding that the private practices across the board have been affected, or is it mostly those that maybe are not necessarily affiliated with certain medical aids that you find are suffering more than others?
I think they're in fact all are. So those that are not really reliant on medical aids will also be experiencing a reduction in demand. And note that they were an essential service, and people could go to them during the lockdown. So it wasn't the lockdown that was causing the reduction in demand. It was the fear. And as we move into this severe phase of period of the epidemic, the risk is going to be that demand is going to certainly also be affected going forward. Yeah. Medical scheme related practices experienced very significant drops in demand. So it wasn't related to access to reimbursement.
Sure. Now, of course, you've been working along with some of your colleagues on a plan which also involves the medical schemes on how the sustainability of these private practices can be maintained. Speak to us a little bit about that.
So part of the anomaly that occurs within the medical schemes environment is that you pay your medical contribution up front, and the money only goes through to the medical practitioners when a service is rendered. So if you're in the public sector, the difference is the taxes are paid and they pay salaries. So if there's a drop in demand, the salaries are still paid. So in the private sector, this drop in demand has an anomalous and severe effect on the financial viability of practices, which also employ quite a lot of staff and have a lot of overhead costs. So the proposal is really to modify the existing fee-for-service system slightly so that 70% of historical claims are essentially guaranteed on a monthly basis, and 30% of payments would be based on activities, the number of times people claim. But also the first 70%, but that would be guaranteed. So essentially what you're doing is smoothing out the payments over a longer time period, over a year. And it's very likely that many medical practices will recover the demand later on. And that can be offset against the 70% upfront guaranteed payment from earlier periods during the year. So this basically at least ensures that there's a smoothing of the revenue to medical practices. The other proposal is medical schemes are concerned about a surge in demand later that could exceed their budget, basically. And so the practices in discussion with them have agreed that there would be a global cap on claims at the levels that they claimed at in 2019, adjusted for prices. And so on that way, both the medical scheme and the medical practices get a lot of certainty in an environment that is now very uncertain.
Sure. You've previously been vocal in terms of government's response to COVID-19. In Gauteng, one of the issues that's currently being debated is whether or not the province needs to go back to a harsher lockdown given the rate of infection and our capacity to be able to deal with the increasing number of COVID-19 cases. What's your impression of the response so far by the Gauteng government? Do you think a tougher lockdown is what we need?
No, I don't. I think, first of all, we're effectively not in a position to introduce generalized lockdowns anymore. One needs to understand that these generalized lockdowns have multifaceted impacts that are so drastic for South Africa that our ability to survive them for very long periods of time is seriously in question. One of the problems that occurs is that when you shut down businesses, you also shut down government revenue, because if they don't earn, and people don't get their salaries, they don't pay taxes. And so government's ability to both sustain the COVID response as well as to provide the kind of income support and protection for people who are now not working is compromised drastically. And South Africa basically really couldn't even withstand the first 21 days of a generalized lockdown. So we cannot go back to a stricter lockdown. We were meant to implement preventive programs and get the platforms ready to prevent and suppress the epidemic without a lockdown. So going forward, we have to have smarter methods of managing the epidemic. We don't appear to have it in Gauteng at this point, but the lockdown is not going to improve matters. It's going to make them worse. We essentially have to find out exactly why our prevention programs are not working and get them to work.
Professor Alex van der Heever, thank you for your time on The Pulse today. He's, of course, with the Wits School of Governance.